guys, my name is Amish Tripathi and I'm the director of the Nehru Center. The Nehru Center is the cultural wing of the Indian High Commission in the UK, and we've been in existence for many decades, and we organize wonderful events at this very auditorium, which is in Mayfair in central London. Sadly, as you can see, the auditorium is empty. It has been empty since we were all put into lockdown due to the coronavirus pandemic. But what we Indians believe is that the other side of a crisis is an opportunity. And what we have done at the Nehru Center is moved all our events online. So now if you attend our online events, every single seat is a VIP seat. Like you get a front row at our events. No trouble of parking, no trouble of traveling all the way. And most practically all the programs that we would do, like literary discussions and dance performances, musical performances, we are doing them all on our online channels. You can register for our newsletter at our website nehrucenter.org.uk. You don't need to write them down, they will be displayed at the bottom of the screen. You can also come to our Facebook page, which is a verified page, the Nehru Center. You can follow updates on all our events on Twitter as well, the Nehru Center, that's also a verified account. Or you can come to our YouTube channel, again, the Nehru Center. We are nothing if not consistent. I hope you do come to our online channels and enjoy the events that we are putting up for you. Thank you so much for all your love and support. Namaste, Jai Hind.
Namaste. My name is Amish Tripathi and I'm the director of the Nehru Center, as you saw in the video just before. Our apologies for the short delay in the commencement of this program. Technical difficulties, these things happen in a live program. Sincere apologies for that. This is a very, very important subject that we are taking up at this event at the Nehru Center. There are two crises. This is in a way a time of crises, and there are two crises which are really affecting humanity deeply in today's day. One is, of course, the immediate crisis, which is the COVID pandemic, and the entire world is suffering from this. It has caused deaths, untold health sufferings, economic destruction across the world. And there is a longer term crisis which is staring us in the face right now, which is that of climate change. And if history and evolution has been witnessed, it has been shown that those species that are resilient, that are adaptable, are the ones who are able to better handle the changes that a crisis throws up. And therefore, the subject of this seminar becomes that much more moot and relevant to the times that we are in. How do we build resilience in the face of the climate change crisis and the COVID pandemic crisis? To discuss this, we put together, and we are honored to have a panel of perhaps the best in the business to discuss this subject. The first and foremost is Lord Nicholas Stern. We are so honored to have him on our stage. If I may introduce him, all the panelists will be brought up in a bit, but if I may introduce our wonderful speakers first. Lord Nicholas Stern is the I.G. Patel Professor of Economics and Government and Chair, Grantham Research Institute at LSE. He has held posts at other UK and overseas universities and as Chief Economist at both the EBRD and the World Bank. He was head UK Government Economic Service 2003 to 2007 and produced the Stern Review on the economics of climate change. He was knighted for services to economics in 2004 and made a life peer in 2007 and appointed Companion of Honor for services to economics, international relations and tackling climate change in 2017. His latest books are How Lives Change, Palanpur, India and Development Economics with Himanshu and Peter Lanjo. OUP, it was published by OUP in 2018. and Why Are We Waiting? The Logic, Urgency, and Promise of Tackling Climate Change, published by MIT Press 2015. He's a member of the high level advisory group for COP26, which, as you know, will be happening later in the year in the UK, of the UNFCCC. We are so honored to have Lord Nicholas Stern as an esteemed speaker on this very, very important subject on the Nehru Center platform. Our second speaker is Praveen Pardesi ji, who is joining us all the way from the homeland, from India. Praveen Pardesi ji, with 29 years, and this is his introduction. With 29 years of experience in the Indian Administrative Services, Mr. Pardesi has served in various senior executive roles, most recently as Municipal Commissioner of Mumbai. That is the city I'm from. That's the city where he is at this point in time as well. Within this role, Mr. Pardesi managed the entire public health infrastructure of Mumbai, a city with 18 million inhabitants. Also, he created and led the task force for COVID-19 containment while also implementing WHO and government guidelines. Along with his work in the IAS, Mr. Pardesi has held senior leadership positions in the United Nations as the global head of UNDP Geneva and senior coordinator of UNISDR. Mr. Pardesi has been a key player in the post conflict recovery programs in various regions. Currently, Mr. Pardesi is working for the Defeat NCD partnership under UNITAR as the chief program coordinator. We are so honored to have you also join us, Praveen Pardesi ji. And before I call Praveen ji up on stage, if I may introduce the facilitator for this very important program, Dr. Ruth Katumuri. Dr. Ruth Katumuri is Senior Director of Economics, Youth and Sustainable Development at the Commonwealth Secretariat. She has extensive experience working with premier international institutions in senior management, sustainable development, public policy impact, and public private partnership. She has established various innovative initiatives and set new trends through her teaching, research, and publications, leadership development, and advisory. She is actively engaged in influencing and impacting public policy and business leadership in India, UK, and globally. She is involved in promoting South South cooperation. At the London School of Economics, Dr. Katumuri founded and has been co director of the India Observatory, an associate of the Grantham Research Centre for Climate Change, and a distinguished policy fellow. She has also been a director of Asia Research Centre at the LSE and has been a visiting professor at various universities in Asia, including in China and India. Dr. Ruth Kadumuri has a PhD from LSE and is a Cambridge Commonwealth Fellow. She is Fellow of the UK Academy of Social Sciences and has published over 30 articles and papers in peer reviewed journals and books. She has been awarded the Mahatma Gandhi Pravasi Samman Award for her contributions. Thank you, fine gentlemen and lady, for joining the Nehru Center to discuss this very, very important subject. And first and foremost, if I may call Praveen ji up on stage, who will guide the program forward. Namaste, Praveen ji.
Thank you. Namaste. Thanks introduction for this very important topic today. I'm just requesting, I'm going to make a small presentation on looking at this current COVID pandemic in the light of climate change and how strengthening the health systems can give us resilience. So call upon Vineet to start.
Thank you, Praveen ji. I will leave the stage to you then.
Thank you. Thank you. So, Vineet, can you put on the presentation? Thank you. So, the world is today facing the COVID pandemic, and we have already lost more than 3 million people as per the official statistics. Next. But the Economist estimates that the unaccounted deaths may go right up to 10 million. Is vaccination the answer for building resilience? So we have seen three countries, United States, India, and United Kingdom, which have taken the vaccination way. These are the countries where maximum number of doses have been administered. And let's see what's happened to the trajectory of the COVID pandemic. Next. So as we can see that the graph of COVID has come down as the vaccinations have gone up. Even though the second waves have left shaken most of the powerful countries, if you can see the second wave in US reached right up to 1,000 cases on a 7-day average per million population. UK it reached up to 800, and India, of course, the second wave where we were reaching up to 3 lakh cases per day, but this weekly average per million population was roughly around 250. And all of this, the decline now can be coinciding with the vaccination. However, as we are now seeing that new mutants of the COVID vaccine, of the COVID virus are coming up, and will the vaccination be sufficient, or do we have to build new vaccines for this? So we are trying to change the lens from which we look at resilience. Next. In addition to COVID, the COVID caused a loss of 3 million people, but annually more than 70% of global mortality is due to non-communicable diseases. And 3/4 of these are in the low and middle income countries. Next. These non-communicable diseases cause more than 15 million premature deaths, that is deaths in the age of 30 to 69, who could have led very healthy, productive lives, but for the non-communicable diseases. These diseases are, next, like cancers, diabetes, cardiovascular disease. All of them are related to various lifestyle underlying factors. Next. Now, this is where we found a very interesting correlationship. I work for the Defeat Non-Communicable Disease Partnership at the United Nations Institute for Training and Research. One of our research found that the underlying morbidity in society, as measured by the amount of mortalities due to non-communicable diseases, that is driving the COVID case fatality rates. So if you see the country at the lower end, Singapore has some of the best health systems and has less than 200 per 100,000 population mortalities. And this has a COVID case fatality rate of less than 1%. As we go up the bar graph of higher and higher mortalities in 2019 due to non-communicable diseases, we find that the COVID case fatality rates keep going up. Next. So we at the Defeat NCD undertook econometric analysis. In this econometric analysis, we looked at the annual mortality ratio due to non-communicable diseases, and we correlated that to the COVID case fatality rates. And what we found is an astonishing result. In 2019, which is the last year data, if we compared countries as per their mortalities due to non-communicable disease, a 10% decrease in mortality rates. That is, a good country like Singapore would be low end, while a country at a very high level would be some country like Philippines. It leads to 20% decline in the current COVID case fatality rate. That is, COVID affects those countries more where the underlying mortalities due to non-communicable diseases are already very high. Next. So we took the current rates. The median rate today in the world is 5 per 1,000 non-communicable disease mortalities, and this leads to roughly 24 per 1,000 case fatalities due to COVID. Next. So in a country in a country like an average country of 60 million people, with 6 million people affected, roughly 10%, a high underlying mortality due to non-communicable diseases leads to more than 144,000 deaths due to COVID. If we were to achieve our sustainable development goal of reducing the premature mortalities due to non-communicable diseases, next. As we reduce the underlying mortalities by making the society healthier, we find that the COVID case mortality rate declines substantially, and we have only 108,000 deaths. Almost 40,000 deaths are averted. Next. And if we were to halve the underlying mortalities due to non-communicable diseases and bring it to 2.5 per 1,000 instead of 5, which is the median rate today, we would have hardly 84,000 deaths, which is a COVID case fatality rate of 1.4 per 100. which is the rate which our countries like Singapore have already achieved, and many countries like South Korea are somewhere close to that. Next. So the real elephant in the room is the underlying non-communicable diseases. Next. Now, as Amishji mentioned, COVID is a huge challenge, but it's a great opportunity also. Why is it an opportunity? If you look at the resources, we find that the World Economic Forum estimated that nearly $371 billion are needed to achieve universal health for all by 2030. If we spend $371 billion per year from now till 2030, then we could achieve the Sustainable Development Goal of 3, which is universal health access. And this will also reduce mortalities due to non-communicable diseases. But the world already set aside in 2020 more than 10 trillion US dollars, which is 2.8 times what is needed to tackle all the universal health access problems across the world. Now, is it possible that we can apply some of the resources already available with COVID? Next. So this is very much possible by re-engineering some of the resources. Some of the touch points which COVID creates for it, track and trace, vaccination, lots of undiagnosed non-communicable disease patients come here, and they can already be detected and provided care protocols which will not only protect them against COVID, but also protect them against non-communicable diseases. And therefore, the resources available today for COVID response can be re-engineered and synergized to also deal with undiagnosed non-communicable diseases. Next. Where does India figure in all of this? India's Atmanirbhar Swasth Bharat program is a very important program which tries to re-engineer our primary health system, which was focused mostly on communicable diseases, but now communicable diseases have come down and their burden is less than 40% in India, to now become health and wellness center, where along with COVID detection, they can also detect undiagnosed non-communicable disease. Early detection means a life saved. Next. In India's non-communicable disease strategy, which is reducing mortalities by 25% by 2025, has led to establishment of 178,000 rural health and wellness centers. And this is also working on the underlying risk factors like tobacco control by taxation, sugary foods control. Most important successful initiative has been the Prime Minister's Ujjwala Yojana, which enabled more than 90 million families to access indoor pollution-free cooking fuel, which has substantially reduced the threat of chronic lung diseases and lung cancer, which the women faced when they were doing cooking on fuel wood. Next. This is already it's an untold, remarkable story from India. From 2014, when mortalities were nearly 585 due to non-communicable diseases, there has been a substantial decline of mortalities due to COVID, and which is down to around 550 now. Next. So the issue then is that if we want to build future resilience to not just the current viral pandemic, but also to possible mutations and other viral epidemics, the way to go is to control the lifestyle diseases by reducing the risk factors. And India has shown some remarkable progress in that by having not only reduced the non-communicable disease mortalities, but in relation to that, India has one of the lowest COVID case fatality rates, which is half the global average of 1.150. But this is regarding the health system. Today, we are also talking about climate change. This is a picture which I took in the forests of central India of a bat. And there are lots of wild bats here. And we know that the COVID virus came somewhere from the bats. Next. But if you look at the map of India, we find that where these wild bats are found in plenty, and these are all the blank white spaces in central India, there is hardly any COVID. COVID is mostly in the large urban agglomerations where we have moved out. So what is this link, and how can the issues associated with poaching, bringing wild animal species into our food chain, which they were not meant to be, and releasing viruses into the human food chain? These are all issues which also impact on climate change. So I will not hazard a guess on that, and I will hand over from now to Lord Nicholas Stern, who is the expert on climate change from the environment point of view. And his Stern review has been a path-breaking document which has brought told the world that the time to act is now. Over to you, Lord Nicholas Stern.
Thank you very much to my friend Praveen, and I have been in the forests of central India with Praveen and learnt so much from him about the environment in India and so many other things. And the points he made about non-communicable diseases and death rates from COVID, I found very telling and very important. And thank you, Amish Tirupati ji. Thank you for your kind introduction. It's a pleasure to be with the Nehru Centre and the High Commission in this virtual way. Since 1974, I have worked on and lived in India on many occasions. And the last time I was on an aeroplane was back home from India in February last year. I hope very much that the next time I'm on an aeroplane, it will be to India and it will be not too far in the future. I also take the point that Praveen made right at the end when he said that the way in which we treat the environment, climate, biodiversity has a profound effect on the new kinds of diseases that can come. If we disturb the relationship between human animals, domestic animals, and wild animals, we increase the probability of these kinds of viruses developing and the transmission to humans. I learned a lot from Lucy Shapiro, who famous biologist from Stanford University. She drew my attention to the way in which birds from different continents now meet in the Bering Straits as a result of climate change, where they did not meet before. And that's a fertile ground for creating new viruses. That's just one example, but so many other ways. If we damage our biodiversity, our environment, our climate, we create all kinds of dangers which come at us. So we have to look after our climate and our biodiversity for so many reasons. I will focus for much of what I'm going to say on climate itself. Um, Climate change works through the greenhouse gases in the atmosphere. Those are the gases that oscillate at a frequency that interferes with infrared radiation coming back off the Earth's surface and trapping it. And CO2 is one of those greenhouse gases, the most important of those greenhouse gases. It's also very long lived. So if we want to stabilize our temperatures, we have to stabilize the concentrations of greenhouse gases. And that means going to net zero of CO2. The earlier we go to net zero, the lower the temperature at which we stabilize. If we want to stabilize at 1.5 degrees, we have to go as a world to net zero emissions by the middle of this century. CO2 equivalent, the other greenhouse gases, a few years later than that, but CO2, we have to go to net zero by mid-century. The earlier we get to net zero, the lower the temperature at which we're able to stabilize. And we know that 1.5 degrees is so much safer than 2 degrees. 2 degrees is obviously better than the 3+ degrees that we're headed to now on current emissions trajectories. But 2 degrees itself is pretty dangerous, and 1.5 much less so. We haven't seen 3 degrees, and we're headed for over 3 degrees on current trajectories for something like 3 million years, when world sea levels were 10 to 20 meters higher than they are now. And think of all the coastal cities in the world, including, of course, very much in India. The risks of climate change are immense. At the 3 degrees or more to which we're headed, hundreds of millions, perhaps billions, would have to move from where they live now, which would become uninhabitable. And that surely would result in extended conflict across the world. The stakes for which we are playing here are absolutely immense. For India, of course, special vulnerabilities. India depends so much, at least the northern part of India, so much for its water from the Himalayas. If the snows and the ice are disturbed, then you get unmanageable flows of water, severe floods, some parts, droughts in other parts of the year. We know that India is very vulnerable to cyclones, including, of course, the city where our friend Praveen is now in Mumbai. So many of the coastal cities are vulnerable to storm surges from climate change and, of course, sea level rise. And a recent study from MIT showed that a big part of northeast India in 30, 40, 50 years from now could be vulnerable to the kinds of temperatures which would mean that you could not be outside for more than a few hours without dying. These risks are absolutely intense, and India is particularly vulnerable. So we all have a great incentive to act strongly now to go to net zero as a world by mid century. Now, India's emissions are well below the average of the world, and her history of emissions is well below the average of the world. India's emissions now of CO2 probably around 2 tons per capita, where the world as a whole is a bit over 5 tons per capita of CO2 per annum. But India, of course, is a very big country with a very big population, and her emissions are growing. They've doubled in the last 20 years. So it would be quite possible for India to be the world's largest emitter sometime in the 2030s. India is at the center of world action on climate change simply because of its size. But we also can see that India can be a world leader on climate action. And that is because India has been moving quickly on developing solar, driving down the cost of solar, of other renewables, and so on. So India actually could be in the vanguard. It has enormous opportunities. It could be the creator of a wonderful new story of development, which is much cleaner and less polluted than what went before. Pravin has already drawn attention to the grave dangers of air pollution. He was focusing on indoor air pollution, outdoor air pollution as well. India has 9 of the 10 most polluted cities in the world. The numbers dying from air pollution or dying from deaths associated with air pollution are something like, on the world average, something close to 20% of world deaths. It may be a higher percentage in India. So by acting strongly on fossil fuels, we not only help to reduce the risks of climate change, we not only find a new cleaner path to development, we also save on the terrible costs of air pollution, which are not all associated with burning fossil fuels, but very much of it. So this new path of development is enormously attractive potentially, particularly for India, which has not yet built so much of its infrastructure and can now plan to build it in a different and much more attractive way. Already, so many of the costs of what we need to do in terms of green infrastructure are lower than what would be associated with brown infrastructure, particularly in electricity, which is absolutely at the heart of the whole story of a green transformation. So India and the world have huge opportunities in their hands in planning this different form of growth, particularly in India as it builds its infrastructure. So this is a story of a new way of growth. It's a story of how to drive out of the recession associated with COVID. But it is a story that absolutely needs investment. So the key policy story is how to incentivize and finance the right kind of investment, particularly in India in this coming decade, as it builds so much of its infrastructure. India is putting together a clear, strong infrastructure program. That's absolutely critical. We need now the policies to put that program into action at the state level and at the country level. That will be involve plans for electricity, plans for the distribution of electricity, integrated grid structures, and so on. It will involve designing our cities in different ways, a much stronger emphasis on public transport and clean public transport. Those are just two examples. But let me emphasize also the great importance on investing in natural infrastructure. India has enormous potential in its natural capital. By that, we mean its forests and its land and its rivers and its coastlines, oceans. That natural infrastructure is something in which India is enormously well endowed. And a huge part of the story of combating climate change will be investing in that natural infrastructure. If we look after our forests much better, we will have a much better pattern of water flows, a much less risk of landslides. There's so many returns to investing in natural capital beyond simply the very important return of reducing the risks of climate change. So India's investments in its power supplies and energy supplies, India's investments in its cities, India's investments in its natural capital, India's investments, which is already showing in new ways of producing cement and steel. All this is a tremendous opportunity, but it does need investment and it needs clear plans, clear strategies for a new form of growth. I believe that story is developing quickly in India. It is developing quickly around the world, but in the world as a whole, it is absolutely not moving fast enough. So we need an acceleration in green infrastructure. We need an acceleration in investments in our natural capital. And I believe that so much of that can be led from India with huge benefits to India and huge benefits to the world. I think in this way, India is becoming and will be a leader of the 21st century. And it's a pleasure to spend so much of my time in India and to be a friend of India and to have so many Indian friends. Thank you very much.
So Namaste has become the best way of greeting people since COVID, even virtually. And hence Namaste to everybody who has joined us today. And thank you to Amish Tripathi for organizing this event and for the wonderful introductions. And thanks to Nick and Praveen for setting the scene for us to have follow-up and have a discussion on very important ways forward, ideas and ways forward for building forward better post-COVID. As Amish rightly stated right at the beginning, it is an opportunity. Yes, we are where we are in the world, but one of the things that we have learned in the past year is how we are one single connected world. What happens anywhere in the world, we are not, with respect to COVID, the standard statement is nobody is safe until everybody is safe. And that, again, Praveen had laid out when he said about the importance of vaccines. Is vaccination an answer? So let's focus on vaccines, for example. Now, Praveen, you mentioned about new mutants. And in that context, yes, the G7 leaders met in the last few days, and there has been a commitment of ensuring that the access to vaccines are available to countries where they have not had, it has not reached some of the countries. I'll just quickly mention, if I take the context of Asia, I have a graph here, which I'm sorry I'm not able to share, but what numbers I have, this is as of mid-May. If I take the region of Asia, I'm looking at it as members of the Commonwealth countries. If I look at Maldives, 56%, it's one of the best records among these countries, 56% have been partially vaccinated and 27% are fully vaccinated. And in the case of Singapore, 33% are partially vaccinated and 25% have been fully vaccinated. If we take the example of India, as of mid-May, and I'm sure these numbers have improved since then, 10% are fully partially vaccinated and 3% are fully vaccinated. So those are some of the examples. But we know that currently, when we are all burdened by the lockdown and isolation wherever we are, vaccination is away and then the variants are away. Now, I think research has shown that research has accelerated, and the world's leadership on medical scientific advancements is very clearly evident with respect to the vaccines. that have been deployed as quickly as possible, overcoming all challenges of delays and testing and ethical uh, testing of the vaccines before they can be administered to human beings. So where do you think? Let's focus on that. What happens with new mutants? How may we as a world address these challenges, which are already beginning to be evident with respect to new mutants? Are we going to see a world opening up or returning to normalcy sometime this year or next year? And in what way should we proceed? And what may we be able to do? Praveen?
So I think that obviously once the spread of vaccination is there to most of the LMIC countries, the world will open up. But COVID safe behavior, the world has changed forever now. And COVID safe behavior, which is basically wearing masks while in crowded places, keeping social distance, will continue for quite a few years. Without that, vaccination won't help us. And as I pointed out, it's not just COVID vaccination, because a new viral strain may need a new vaccine. And how long can world be chasing new vaccines and new viral strains? So some of the points which Nick mentioned about mitigating the climate change through preserving the natural capital, not allowing the new viral strains to get into human food chain from the animal food chains by destroying wildlife and forest areas. So that those are very vital, both to preventing or rather mitigating climate change, but also mitigating future risks of future pandemics for which we don't even have the vaccines today. So that's one issue. And second is something which we already know, that whatever viral epidemic comes, it feeds off an unhealthy society. Therefore, if we are able to reduce non-communicable diseases through underlying risk factors, which is air pollution is one of them. The other one is the type of foods that we take. And third is leading an active life, which again has an impact on climate change, because if we cycle to work rather than go by a fuel-based automation, we not only become healthier, but we also mitigate climate change. So it's these measures which will make the world resilient, and not just vaccination.
Thank you, Praveen. Nick, would you like to come in to sort of lay out for the audience here as to, at the moment, yes, we will come back to the points Praveen raised about additional solutions, but let's focus on vaccines and how effectively are we able to vaccinate everybody before we feel safe and as far as possible.
Thank you very much, Ruth. And once again, I fully subscribe to what Praveen was saying, both about the importance of non-communicable diseases and the relationship between humans and natural capital as both being absolutely critical in terms of controlling fatalities and controlling the arrival of new forms of virus. But we also have to recognize now, as Praveen said, that COVID is with us in humans, and it's living off and in humans. And that's why there's a race, I think, to get the vaccine quickly. Because otherwise, the later we go, the more new strains that there are. So I think we should be aiming to have the whole world vaccinated by the end of 2022, the end of next year. And I think that it's quite possible to produce physically the amounts of vaccines that are necessary in very good time for that. But of course, you have to get the distribution as well. But it's not enough just to look at the end of 2022, because it's a race. The virus is in humans, it's adapting to humans, it's moving on. And the faster we get the vaccines out, the more we are able to control the new viruses. And of course, we will have to, I think, be vaccinating probably every year against COVID from now on, as it continues to adapt and develop in humans. But there is a race, I think, at the moment, and those countries that are controlling most of the vaccine supplies, I think, have a deep moral duty to move the ability to vaccine very quickly to the rest of the world. And of course, it's also in their self-interest, because the more new virus strains there are, the more vulnerable they are. Both arguments count. I don't like the argument only of self-interest. There's a moral duty there as well, but both are important. It's a bit of a race at the moment.
Thank you, Nick. And the positive thing that you have mentioned is that that race is achievable. And I think that commitment was also shown by the G7 countries. And I think COVID has taught
us. I think not strongly enough.
Hmm.
You know, they offered 1 billion doses by the end of next year. You know, we have to vaccinate the world by the end of next year, and we need a tight program. Milestones along the way. So some good intentions, but in my view, not strong enough.
Thank you, Nick. And that's important to be highlighted, particularly coming from your leadership. And we have learned during COVID that I think everybody has increasingly realized that how we have to work together and we have to collaborate, such as the WHO, the WTO, and I'm sure Praveen, from where he is with UNITAR, also will be seeing examples. So the Commonwealth Secretariat is also working with WHO, with Dr. Tedros and Dr. Ngozi, about how can we enable more equitable distribution of vaccines across developing countries as well, and especially when we've seen the second wave of the severity of the second wave, both in the UK, where some of us have experienced really severely, including personally, but also the enormity of the second wave in India with respect to volume has reached a scale where we have friends, colleagues saying we have become numb to death. It's simply because of the size of, the volume of deaths in India. So definitely, and thanks for that message, Nick, because it is important that we focus on distribution of vaccines. 2022 is I wish the target can be made closer. Then going into this
next, the milestones, the whole world must be completely vaccinated by the end of next year. But there's an urgency. The milestones along the way, it's not just that thing at the end of next year, it's the urgency now. And so we have to have the non-communicable disease strategy, which Praveen described, the natural capital strategy, the personal disciplines that Praveen described, and the rollout of the vaccines. We've got to have all these things.
Yes, so that's
Ruth, if I may step in for a second. See, the problem with the vaccination and the race, with the race for vaccination is the following: that if in 1 6 months period, if the entire world doesn't get vaccinated, then the people who already got vaccinated but didn't get their second round of vaccination can still become carriers, because this thing may not last. The vaccination immunity may not last for more than 6 months. So it's all and within a short time span. So that's a big ask. And then, of course, the mutations are taking place. So we don't know the efficacy of vaccines to future mutations. That's why a comprehensive multi-pronged strategy is the key. So vaccination, yes, it's number one, but COVID-safe behavior is number two. Number three is controlling the underlying non-communicable diseases, which is a known knowledge. There is no science involved in that because we already have the science well established. And the fourth one is natural capital and conserving. If we do this multi-pronged, only then can we make the world resilient.
Yeah, that's perfect, Praveen. So let's go deeper into this multi-pronged approach. And I think you laid out very well and very clearly the argument for, and also the re-engineering of health. I think that's an important point that you made about how do we use the existing resources. If we are looking at 371 million to achieve SDG year on 2021 and then scaling up to 2030, but you showed how 10.5 trillion is needed, has been, for COVID, it's 2.8 times in 1 year alone. So, and then the suggestion you made about re-engineering, how do we interconnect all these things while addressing NCDs, non-communicable diseases. You listed a few, and what comes to mind is, for me, malaria comes to mind, and we've also touched upon air pollution. And you know that in India, progress has been made, progress has been made on addressing malaria as one of the NCDs, but also there are more challenges. At the same time, air pollution is a big challenge for India, and this is an opportunity, as I think all of us believe and agree in our discussion today. So you talked about re-engineering health and saying how this can feed into each other. Could you elaborate that a little bit more? And perhaps something more with respect.
Yeah. So it's one of the very interesting things about non-communicable diseases, people can live with it without knowing about them. Poorer people live with diabetes never having been diagnosed. Poorer people live with cancer until it becomes too late. They don't detect it at the first stage. And same with cardiovascular. What COVID does is, because of the track and trace service and the vaccination touch point, India has already vaccinated 240 million people. And is going to, if it stays on track, it will be vaccinate another 300 million people in the next month and a half. This is a touch point between the health sector and people. But at this point, if we can diagnose and detect and screen for non-communicable diseases who are unknown yet, we can ensure that the underlying risk factor to COVID also is addressed at the same time. So the funds are the same, the health system is the same, the staff is the same. It's putting on a new lens of NCDs. This is one big thing. And the second is the primary health center, which was only focusing on communicable diseases because of vaccinations against the communicable diseases. It needs to be re-engineered to focus on the lifestyle diseases.
Primary health centers, Praveen. I don't know if Nick wants to add anything. And then there was a question, if that can be put up so that Praveen and Nick can see that question again and respond to that as well. So we have a question from Vinod Menon saying, can you throw some light on the neglected tropical diseases and the efforts needed to address the challenges of diseases like dengue, chikungunya, malaria, and several other diseases becoming endemic in several countries?
Yeah, let me pick that question from Vinod Menon up alongside the issues which Praveen and I have already been discussing about climate and health. The impacts of climate change have a deep, deep effect on health. Clearly, cyclones kill people. The sea surges kill people. We're moving now to temperatures, particularly in northeast India, but before long it'll be very much more than that, which are potentially fatal simply as temperature. So much of India still depends on agriculture, and so much of the agricultural activities could be gravely undermined by climate change. So the impacts of climate change have potentially devastating effects on health. But as Praveen has already argued, the actions that we take to reduce climate change themselves improve our health. Of course, cutting air pollution improves our health. Cycling and walking improve our health. Eating less meat reduces emissions, and that improves our health. There's so many parts of the actions we need to take. A better relation and investment in natural capital will transform our health as well. So there's so much of what we have to do to combat climate change, which is very attractive in its own right, including for our health. If we look at the impacts of climate change, let me cycle back to that for a moment. Uh, on the whole, a warmer world is a wetter world. Some places will be much wetter, actually, other places will be desertified. But on average, it will be a wetter world, and new places are likely to be subject to um, the kinds of weather and water which make malaria and dengue fever much more likely. So climate change itself is going to, unless we act very strongly, is going to profoundly affect the incidence of malaria and dengue fever. But fortunately, there's so much we can do. We know a great deal about tackling malaria. We just haven't done enough of it. And we've seen recent advances in the tackling of dengue fever through controlling the mosquitoes themselves in various ways. So I think that climate change, the impacts of climate change are on the way. There will be more. So that underlines the importance of tackling diseases like malaria and dengue. And actually, we know so much about what to do. It's a question, in large measure, of implementation.
We know so much about what to do, but how can we do and what more can we do? Praveen, if you can touch upon that also, that question, saying also referring to India's Atmanirbhar Swasth Bharat scheme, and what more can we do practically? You did mention the primary health centers, which is an important avenue through which we can do that. Anything more you would like to add on that?
So what we found is when the global initiative like Gavi, which was about the global vaccination investment, took place, the world across the world access to vaccines has become almost universal, and that's why communicable diseases have been counted. However, that has not happened with respect to non-communicable diseases. That is, the access to drugs and diagnostics with respect to non-communicable diseases, there is no such mechanism. The Defeat Non-Communicable Disease Partnership in UNITAR is trying to create a similar marketplace where LMIC countries and patients in need have access to a diagnosis, and second, based on the diagnosis, the treatment protocol, which the world has already shown it possible in the case of AIDS or in the case of many other communicable diseases like smallpox, which has been eliminated. But the world today is now facing more non-communicable diseases. And the way to tackle that now is to ensure that the marketplace becomes more fairer priced, and there is a much better way rather than the markups which take place for whenever these medicines and drugs are made available in poor countries and to poor people. So this is one thing I wouldn't like to add anything further to what Professor Nick Stern has already said about tropical diseases.
Thanks, Praveen. And I think, I don't know how much time I have. Can someone tell me how much time we have?
But I think we have already reached the 1 hour.
No, we started a bit late, so I'm just wondering if we have a few more minutes.
Of course,
because now let's talk about financing, because both of you have already mentioned the importance of finding the financing for this triangular impacts of health, climate change, and economy as well, because economies have been hugely affected. And Praveen, you showed the numbers of the costs on for COVID and how countries have got into debt. So what can we do with respect to, yes, we need innovative, and Nick mentioned some with respect to infrastructure, and say, is there anything more that we can present at this discussion? And in that context, we had a good question from Netra Sharma saying, can we set up a common fund for R&D on NCD and climate change induced diseases? So who wants to go first? About financing and investment and innovative financing.
Let me focus. I'll leave the financing of the disease side to Praveen. Let me focus on the financing of infrastructure, because if we're to reduce our emissions sharply, if we're to make our air much cleaner, if we're to look after our natural capital much better, we have to invest, and we have to invest quite strongly now. And that for India is particularly important right through its infrastructure investment, both in physical capital and natural capital. A big part of the investment will be private sector, not all of it, but a big part of it will be private sector. On the natural capital side, probably more of it will be public sector, but that's the kind of blend that we have to put together. So it's extremely important to have clear plans for the way in which the cities and the infrastructure will move, and the way in which natural infrastructure will move, within which investors can make their own plans. It's important to get the incentive structures right, to stop subsidizing fossil fuels, to phase out subsidies for fertilizers and so on, so that the incentives are right for the right kind of investment. That's absolutely critical. India will need to increase its investment rate by perhaps 3 percentage points of GDP to get in place the cities and the energy infrastructure and so on that is so desperately needed if sustainable growth is to be created. So that investment story is absolutely at center stage. Now, India is a big country, and much of that investment, indeed the majority of that investment will be financed within India. But it's also the case that it's very important to bring down the cost of capital. For many infrastructure projects in India, you have to pay 8, 9, 10% on your loans. It's very difficult to finance your infrastructure projects on that basis. There's so much that the world can do through the multilateral development banks to help reduce the cost of capital and to increase its flow. I think India's National Development Bank that is just starting can be an important part of that story as well. So you need the policies to draw through the investment, and you need the finance with the right kind of finance in the right place at the right time. Big part will be private, but we need to see the world's multilateral development banks, and indeed India's new development bank, to step up.
Financing can play as well. Praveen, if you can focus on the health angle, but also as a senior civil servant with India who knows sort of the heart of India, the inside policies, and can you also talk about what is India's capability for financing in this situation, and how well may India be able to find the finances?
So one of the two big opportunities for India is the pharmacy to the world. Most of the generic medicines are produced in India. Same is true for the vaccines. Secondly, a lot of the health infrastructure is non-tradable. That, as Dr. Nick Stern said, the investment has to come from within India. So it doesn't need to come from external resources, which are very scarce now. So it's mobilizing domestic resources, mobilizing the domestic industry. That is why the new program which has been launched by the Prime Minister is called Atmanirbhar Swasth Bharat, that is self-reliant Healthy India program, because a lot of these are non-traded components and therefore can be invested domestically. There is what the Defeat NCD partnership has been promoting is pool funds. So we pool funds across different ministries, because this whole sector of non-communicable lifestyle diseases is not amenable to just a health sector intervention. As Lord Nixon just mentioned, that cycling or making more public transport or ensuring a more healthy life through the sports ministry can impact non-communicable. This is much more than supply of medicines can. So that's why it needs a multi-pronged strategy, and creating pooled funds. That's one innovation. The second innovation is we don't need to really go for the previous aid flows mechanism, because there is not likely to be that much aid. A lot of these initiatives are market viable, but they need support from from the venture capital mechanism. Lots of IT companies, artificial intelligence paired with telemedicine, and small startups can take the health protocols of non-communicable disease at much lower cost, with one doctor addressing hundreds of patients in remote rural areas without the need to travel to them. So technology has enabled this, and these need venture capital to support these types of startups so that the community upscaling can happen. So I've just mentioned three things. One is non-reliance on external resources, because health is to a great extent a domestic sector. The second point is pooled funds, not department-wise funds, but pooled across different sectors. And the third is relying on the market mechanism, because there is a vibrant startup community both in the IT and the health sector. These needs to be scaled up, because today interventions can be reached to rural, remote regions leveraging technology and AI, but these startup capitalists need support from the venture funds.
Those are very important
That's
points. Yeah, no, Praveen, those are absolutely important points. Bringing in the context of the private sector, and in the land of entrepreneurship such as India, and the land of Jugaad, where is innovation at the bottom of the pyramid as well. I think, and India has been a central player in the generic drugs industry, in enabling, in fact, even with response to providing vaccines for the world, India has played an important part with respect to manufacturing of vaccines. So bringing together these innovative methods of public and private sector engagement and the synergy and the challenges of health, climate change, and economy. I think this has been a fabulous expert of the Stern, Nick of the Stern, author of the Stern Review, and who has been engaged with this for nearly 20 years, Nick. And with respect to financing, because you worked at the top multinational development banks, and you were involved with the formation of the New Development Bank, and it's good to hear that it is accelerating the work it does. So coming together with respect to public, private, plus also the international organizations and the international financing institutions, plus national level attempts, national level commitments. Praveen, you highlighted that very, very clearly, but also people, individuals have a responsibility too, to make choices in the way they walk or cycle or what they eat, and how do they live. I mean, this is nature. We didn't touch upon nature-based solutions, but I think thank you very much for this very enlightening conversation. And you could see the comments that people have been responding very positively. So thank you everybody for joining, and thanks to the panelists and to Amish for organizing this.
Thank
Bye-bye.
you. Thank you, Dr. Nexta.